So welcome, Dr. Hardik. Dr. Hardik has been a friend now. We started many years ago. Our journey started practically almost 20 years back or even more,
Yeah, more.
where we just casually met at one of the parties, and then since then we have been together doing lot of academic work, lot of academic activity, and learning autism at Spandan with Dr. Barwalia was one of the major uh, events, if we were to say, or major epoch, in fact, of our life together. We also attempted to create the Spandan Center at Ahmedabad. It did work for almost a decade. So lots of experiences with autism that we have shared together, and we will see how his individual journey also has been. And he's going to be a faculty at the course of Roadmap to Autism Part 2. So welcome, Dr. Hardik.
Thank
So
you.
tell us about your journey with autism and special children. What has been it like?
So, a lot of reverence goes to this 20 year of journey working with you. Previously, I only have heard of word like autism. Dyslexia, I never even heard of before. So, thanks to you that we got connected with Dr. Barwalia and gradually starting that work, attending the cases with Dr. Barwalia, seeing actually what are autism patients, how they look, first of all, and going into small things which are related to autism. First comes like looking at the patient. Diagnosis is much later on. But then before diagnosis, we pass through various checklists, various battery of symptoms. Whether this goes into autism, it is not autism, it is something else. That has been a journey and it has still been going on. So I would say it is a never-ending journey we started 20 years back.
So, what has been the most difficult part for you, and what has been the most enriching part of the journey for you?
So most difficult part was first diagnosis initially. So we had only knowing about autism, but then there are various other associations like oppositional defiant disorder and CDD. There are various other communication disorders. It intermingles with ADHD. It intermingles with multiple things. There is something like IQ which is coming into picture. The first thing, these were the new words for us. So first jumbling between the new words was a challenge, which we gradually overcome going through the scientific literatures like DSM-4 and revised edition at that time. And then the most enriching thing was integrating the aspects of autism or other all behavior problems where homeopathy can be helpful, where it cannot be helpful, and where all other disciplines come into picture. And without that discipline, this is a very halfway thing what we do with homeopathy. So this was an enriching experience for me. So multidisciplinary approach, I would say, is the enriching experience for me so far.
So, for me also, it was a very similar experience when we started. I had no idea what autism is. First time I heard about it, what mental retardation was only a heard thing, and largely we owe all this to Dr. Barwalia, who has really trained us rigorously. And I remember both of us would be informed just 2 days before that tomorrow, look, there's a workshop, you have to come. And traveling from Ahmedabad to Mumbai, we would take newspapers along and sleep on the floor of the train and go. And sometimes it would rain and the train would not even reach Bombay during the rains. That was the time, but it has been very exciting because during this time, we would be discussing a lot of our experiences, lot of our thoughts. So it was very instrumental in building up the canvas on which we are going to treat our future patients then.
Yes.
And I believe that a lot of new generation homeopaths are missing out on this. I very little see the younger generations coming together in a forum for a meaningful, beyond beyond exams, beyond book, beyond subject discussion. So when me and Hardik are together, there is a lot of discussion that is beyond just our subject. And unconsciously, small data points are collected over many, many years, which go on to formulate how you process the information.
Yes.
And as Hardik said, everything of this was new for us. And the challenge in autism cases is how we are going to process this data. It's less of history taking is not so much of a challenge many times in autism because things are quite obvious.
Yes.
But processing the data is the challenge. So I will ask Hardik, what has been your experience in this data processing once you have got the symptoms?
So once we get the symptom, first thing is to classify the symptoms. And autism is a spectrum disorder. So classification is very important because mainly communication is challenged, socialization is challenged, behavior issues are challenged, and the intellect part may be affected, may not be affected. It palpably looks it is affected, which it may not. So we segregate the symptoms into these facets. And then we try to form a self-scoring sheet in every patient. Okay, which symptoms are more remarkable, which are unremarkable. Like it is not necessary that a boy or girl having autism will have these all facets active. For some maybe communication is more dominant thing. For some the behavior part may be dominant thing. So we segregate these symptoms, and this is the first part of the process. Once we get the diagnosis, or once we get the symptom, and the next phase will obviously be the scoring sheet. Officially, if it has been done by a clinical psychologist, we try to match these both things, and then we classify again, like the patient is into milder category, moderate category, or a higher category. So this is the first phase whenever we take a case.
Then what happens? You have classified the data. Then what's the next step that you normally would take?
Next step, like very commonly what we do in every patient, classify the common symptoms, classify the uncommon symptoms. Now in autism, everything may look like very same. Like we can tell that every autism patient has socializing skill issues, communication issues. But then we try to individualize that. We try to deepen that aspect. Communication had to be like which kind of communication issue, or where the problem is there in socialization. Is in the family, is in the school, it with peer or not with peers. So this is the entry point only, and that's how we even more enter into some deeper case taking, and then we classify symptoms which are bit peculiar, queer, and which is very specific to this boy or girl having autism.
Yes. So we can get a glimpse on the processing of most of these cases with autism or neurodevelopmental problems, but you will have to enroll for the course when you will actually see this being put into action. So any other interesting experience, Hardik, you want to share, which would really want, that would encourage people to take on this course, and because autism is becoming more and more common in our clinics.
Yes. So one highlighter point was like when we started working with autism. As a homeopath, it was very obvious that we don't know any know-how about autism. What we are knowing was Down syndrome and MR, nothing else. But then we realized even pediatricians do not know anything about autism. This is I'm talking 20 years back. Now it is becoming very, very common for pediatricians. Pediatricians also diagnose at that level. Facilities are there.
Yes.
So for this course, if you are joining, it should be divided into a couple of things, like the diagnostic part, one is the history taking part, and then the processing part, which includes the repertorization and eventually selecting the medicine. Now, this is just the starting point. If we expect that we are going to cure autism patient, it is not going to be. Initially, it became very hopeful. Autism can be cured, but it is more like learning while doing process. We realize that every patient is different, and it is going to be a different challenge each and every time. So it requires like not a 20-20 match, but it's a test match. You have to go long, very, very long in these patients. Every small change takes a time. So there are few patients where we have got immediate results. And there are patients who have waited for 5, 6 years and then we are getting results. So every patient makes you pass through a different journey. And we have to also enter the parents' world, how they are facing the challenge, how they are adapting to the challenge. So a lot more things depends on that also. I remember a small case in my practice that actually parents were the game changer. Both parents working and they recognized that okay now child is having autism and one of the parent was into education teaching in a corporation school, but then they dedicated themselves for 6 to 8 hours behind this child. They went wherever they can for testing, for occupational therapy, and for homeopathy. And if these three things work together, results are super short. You can't imagine this boy that this boy had autism. You can't make any difference between a very normal boy and a boy having autism.
True. So I think some of you would have also attended the part one where we had opened up this new avenue, and we are going to deepen this sharing of integrated practice, where we are going to integrate inputs coming from the psychologists, coming from the parents, coming from the occupational therapist, sometimes even coming from the special educator. So, Hardik, how did you integrate these inputs? Because for homeopaths,
It's a very
everything is symptoms, right?
yes,
And
yes,
repertory. I mean, what use it has, because if I were to talk with many of my many of students or colleagues, or so we are at sea. How do we integrate the psychologist input or all these experts? And let me tell you, these experts are seeing more autism cases than what we
yes,
see.
yes.
So to disregard their input would be a loss to us, and more so the loss to the child. So how do you go about, what were the challenges you faced, and how did you overcome these challenges?
So first of all, I would say that it's a crime if we do not take their inputs while we're treating the child. Recently, one occupational therapist, because that occupational therapist sees this child daily. We see once in 15 days or in a 1 month. So he notifies everything. A small change after a month or 2 months, he would ask the parents कि आपके doctor को बोलना कि now this aspect is better and this aspect is not better. So ask your doctor to work more, which may not recognize on a 1 month follow up or a 15-day follow up. They look at it daily. They could notice every small change happening or not happening. So their inputs are the most valid inputs, I would say. And gradually, we also every 6 monthly or a yearly, we go for the repeat checks for the scoring sheet. So the psychologist point of view becomes very important. So we have to integrate both of the things.
Yes. So one will have to learn each other's language also during this process. So it's a very enriching experience, though initially it can be very frustrating because this topic is not really covered at undergraduate or even postgraduate levels. But looking at how the disease uh, is changing in front of us, and the number of cases that come to us with autism, even early on in practice, young practitioners will also see autistic children. So for them also, this whole session with different perspectives is going to be very, very eye opening. So I would encourage all of you to do register for the program. We're going to put the details in all the link below and all the details below. So another thing, Hardik, you mentioned that some patients respond very fast and some patients take very long time to respond. What happens, during this time, in the follow-up time? What happens to you as a clinician? What is the thought process? What is the experience that you go through?
So it is frustrating first if you are not getting results. This is one aspect. At the same time, when it is not progressing, it challenges you. Like you are tempted to change the remedy multiple times, which will be counterproductive. So many times you have to hold your nose, wait and wait, and at the same time, empathizing with the parents, because their frustration also, their meltdowns are also equally important. So their questions will be keep coming. How to address that? How to answer them? So it is something of a self counseling also and parents counseling also. So uh, I have a child currently, he's with me since 2 years now, but nothing is responding so far. What is responding is that parents are bringing him with a hope, but they have at least realized that things which were getting worsened are not worsening, they're static. But then repeated counseling of the parents, expectations of the parents, because whenever a patient comes to us, the expectation ratio is very high from parents. And this is the most challenging thing. You know, in 3 months come and that boy is not started speaking, or okay, ye to hua hi nahi, what to do now? So we have to explain them to take time. And multiple other aspects are equally important, like how the child is spending time.
So, as I could just put it in a nutshell, it is going to be a learning experience how all of us who have been working with autism for so long have overcome this emotion of frustration, this emotion of living up to the expectation of the parents, which sometimes is unrealistic, our own emotions that come in the phase when the case is just progressing very slowly or not progressing at all. So it is not only the physician in you that is challenged with every follow up, not just every case, every follow up, but it is also the human in you that always tends to jump out. हाँ, like Hardik said कि चलो रेमेडी बदल देते, कुछ नहीं हो रहा है. But what we have learned in our experience is if you find one change happening in the follow up, you don't change the remedy, you hold. And that's what Hardik said, you really have to hold your nerves sometimes. Don't have to repeat or don't have to change the potency, just stay. So this comprehensive experience is what we are going to get during this course. So any other points, Hardik, you would like to convey to the listeners, and why they should enroll for this course? What is it in for them as clinicians? Even some teachers do enroll, even some senior practitioners are enrolling. So what is it there for all of us?
So one side is the very academic side, where it will be all know-how about autism. And one side is a very clinical side, where actually we'll be sharing what we have done as and when, 20 years. So it is more would be like case bank, studying through the case banks and small experience where every follow-up we are taking and what we pass through, what a patient pass through. So I would say in one line, it is more like learning while doing. We'll be sharing a journey in that.
So it is going to be a very multi-dimensional journey that aspects will be opened up with each speaker. So we will have Hardik doing one session, we will have Dr. Praveen Jain doing one session, Dr. Purnima Gupta, who is a psychologist with whom we spoke last week, is doing one session. And then we have very senior occupational therapist, Dr. Subhash Apte. He will share his experience from the point of view of occupational therapy, and that is going to be new for all of us, including me. So I'm very excited to bring this program for all of you. Do take advantage and do enroll. So see you all at the program, and thank you, Hardik, for sparing this time to share your experience. Yes,
One line.
yes,
Since you quoted Dr. Subhash Apte, he's an occupational therapist. Now, what we have realized, I mean, we both have realized that no occupational therapists, before that they were not knowing role of any homeopathy in it. But now they realize that if you are adding homeopathy, they see some visible changes in their patients. So they
yes,
were patients homeopathy.
yes. So in fact, the situation now over these years have been that when occupational therapy is frustrated, he will say, go see the homeopath. And then we are able to make a shift. And that's the beauty of what we can offer to these little kids and to the family as a whole. So see you all at the course, and we will soon have Dr. Praveen Jain also in the live YouTube live. This is a recorded session though. So bye bye and see you all.